Hello everyone, this is Dr. Priya here and welcome to New Roots Hair Clinic. In the last video, we talked about what are the psychological stress that happens because of hair loss or alopecia. In this video, we'll talk about how to deal with that stress. Now, there's a lot of ignorance when it comes to managing that stress in both men and women. And you should always remember that stress related hair fall or hair fall that is related to stress, both these conditions are not permanent and it can always be reversed. So the first thing that a person should do is visit their nearest dermatologist, trichologist and physician and start the treatment under their supervision. Because there are still many people out there who will just try and use over-the-counter products, like there are various shampoos and oils that claims to stop your hair fall, and that is not the case. If you just keep on doing that and not visit your doctor, it will just progress grade of baldness. Patients after starting the treatment should keep their patience so that the hair cycle it gets normalized, which can take about a minimum of 3 to 4 months for its physiological effect to show. Most of the times I've seen that patients fail to be consistent in their treatment, as many of them may experience increased hair fall in the initial phase. But once this is happening, please remember that it's a good sign. It means that your treatment is going in the right direction. Now, before we move on to the next point, I want you to know about something that is called phases of hair growth. It's a cycle. So the first phase is your anagen phase. In anagen phase, it is commonly known as growth phase, and most of the scalp hair is in anagen phase only. About 80 to 90% of our hair is in anagen phase. The second phase is called catagen phase. Catagen phase is a transition phase where your roots it gets detached from the nourishing blood vessels. And the third phase is known as telogen phase. This is known as the shedding phase. This is the phase when you'll start losing your hair. Now, I mentioned earlier that there are few patients who will notice more hair fall once they have begun their treatment. The reason why I said that, in the initial phase of treatment, most of the hair follicles which are in the telogen phase, which is the shedding phase, will shift to anagen phase, which is the growth phase, and all the other follicles which are in the catagen phase will shift to telogen phase, and thus the hair fall increases, and this is absolutely a normal course. Now let's talk about what are the measures that one should follow who are suffering from hair loss. The first point is balanced diet. Healthy diet along with balanced quantity is very important for everyone. Food which are rich in biotin and protein helps in hair growth and it reduces stress too. Now antioxidant food helps in increasing the follicular strength. Food which are rich in iron, calcium, vitamin C, vitamin E and omega-3 fatty acid improves the quality of hair follicles. The second point is enough sleep. If a person is getting at least 7 to 9 hours of sleep, it really helps in reducing the stress and anxiety. It also maintains the hormonal level. In order to get a good sleep, what you can do is you can keep your room a little darker and cold and make sure that there is no sound disturbances. Also, please keep your electronic gadgets and phones away. The third point is consistent exercise. Practicing regular cardiovascular exercises, regular yoga and meditation really makes our mind stronger and keep our mind calm also. It really helps in coping up with all the stress. If not that, then what you can try and do is engage in various activities and hobbies, whatever you like. The fourth point is consult a psychiatrist. If stress is the main reason for your hair fall, then one should not be hesitant to see their psychiatrist. So my fifth point is hair hygiene. One should take care of hair so that it does not get damaged and remains healthy. And they should avoid doing unnecessary things like using too much heat treatments like ironing, curling, other chemical treatments or dyes, or using too much hot water for shampooing, because that can really damage your hair. My sixth point is consult trichologist. One needs to visit his doctor regularly and should not panic, as it may lead to more stress, and more stress leads to hair fall. Nowadays we have various treatment options that you can go for, like using DHT blockers, minoxidil, serums and various other therapies like PRPs. So my last point is actually a very important one, and that is one should be patient enough to see the hair fall control. It might take some time, but it is going to happen eventually. So these are the ways we guide our patients in New Roots Hair Clinic with all the necessary precautions and suggestions along with indicated medicines. Please remember that you should always handle these situations with positivity and a calm mind, because there's always a solution to every problem. I hope this video was helpful to everyone out there. I'll see you again with another video. Till then, please take care.